Hello and welcome. You're watching Health and Wellness Myths versus Facts. I'm Ankita Mukherjee. We've been dealing with a global pandemic since March 2020. It's had an impact on every aspect of our lives. Now, the pandemic has affected every corner of our world, physically, emotionally, financially. It's brought about new challenges, feelings of uncertainty for absolutely everyone. Now, mental health has long been recognized as a factor in one's physical well-being, a fact that has become starkly apparent more so in the pandemic. Stress, isolation, uncertainty, these can all exacerbate anxiety and depression in people who already have chronic illnesses like diabetes and cardiovascular disease. Now, this can in turn lead to poor self-care and worsening health problems. Many of us have been working from home, and this has also affected our sleep rhythms, and stress and sleep deprivation have in turn affected chronic metabolic conditions the most. But unfortunately, it's a topic that's not talked about very much at all. We still try and sweep mental health problems under the carpet, and that can be a huge cause of stress too in situations like this. Well, this program is going to try and do exactly that, talk about the correlation between mental health and our existing metabolic conditions and equip us to cope in such extreme situations. Joining us on the program, Dr. Nilesh Detroja, MD, Medicine, DNB, Endocrinology. He's a consultant endocrinologist and diabetologist with the Harmony Super Speciality Hospital in Rajkot. We're also being joined by Dr. Abhishek Pandey, MBBS Medicine, CCEBDM, PGP, Cardiology, Assistant Professor, Department of Medicine, Institute of Medical Sciences, Banaras Hindu University. Thank you both very much for giving us your time. Dr. Detroja, let me begin with you. Now, endocrine disorders seem to span a range of conditions from diabetes to thyroid disease, and stress has been linked to several health problems, and it can also exacerbate certain existing conditions. So can you tell us specifically how stress affects the endocrine system and what hormones specifically?
Stress is part of today's life. So everyone is having some or other stress, and it's difficult to come out of that. So whenever you have any kind of acute stress, body will try to react with that. So body will produce stress hormones like cortisol and adrenaline. So these are the two hormones which are called stress hormone, and these are released from adrenal gland. So body is having wonderful mechanism. So there will be a flight or fight response to stress. So it will settle the whatever stress we have, and there won't be any harmful effects to the body. So it's kind of protective mechanism of body. But whenever you have chronic or long-term stress for a long period of time, then question comes. It will affect all the parts of body, all the systems of body, like cardiovascular system, respiratory system, endocrine system, musculoskeletal system. This system and cardiovascular system, these are the two systems which are affected the most by this chronic stressful condition. So it will lead to development of diabetes, or it will lead to worsening of diabetes, hypertension, myocardial infarction, and other cardiovascular disease.
Dr. Abhishek Pandey, is it true that people who are dealing with type 1 or type 2 diabetes, living with this, are at increased risk for depression, anxiety, and eating disorders? And if this is indeed the case, then how can people with diabetes better manage the constant stress that they undergo in any case? They have to monitor their blood glucose levels, they have to constantly think about their diets. That can get stressful too.
Yes, people living with type 1 or type 2 diabetes are increased risk for depression, anxiety, and eating disorder. Depression and anxiety are common mental illness, and their association between diabetes with this problem can be co-occurrence. There will be other way around also, that diabetes, because of diabetic patients are in a lot of distress because they have to manage their sugar with the change in the lifestyle, with the change in the diet. So they are in constant stress, so leading to a lot of depression or anxiety. Eating disorders are common in type 1 diabetic patients in young adolescent female. So how to identify it? first, it's very important that you are suffering from this problem, you need to identify. So it should not be ignored, because many times we see patients that they ignore their problem. They think that just they have to control the sugar, but if they are having eating disorder, they are not discussing with their doctor. So this problem need to be discussed with the healthcare provider, and they will better guide you in a proper diet, that how to manage it, and that different stress needs medical interventions. There might be possible that a simple counseling is going to work. So the first and foremost important thing is to identify the problem, that yes, you are suffering from depression, anxiety or eating disorder. Then you can discuss with the solution with your healthcare provider in forms of counseling, in form of diet modification or other behavioral changes.
Dr. Detroja, you're back with us, I believe. We were talking about how stress affects the endocrine system. Your response to that.
Yeah, so stress is a common, very common in today's day-to-day life, and we are all are having stress issues. We have hormones called cortisol and adrenaline, which are being synthesized by our adrenal gland. So whenever we have any kind of acute stressful condition, body will secrete these hormones and there will be kind of fight and flight response. So this is a kind of protective phenomena. It will protect our body from this stressful condition, and it will not harm our body. But whenever you have chronic stressful condition for a long period of time, then it will probably affect all the parts of our body, whether it is cardiovascular system, endocrine, respiratory system, GI system. Out of this endocrine system and cardiovascular system, these are the two major systems which are being affected by stressful condition, and it will affect your diabetes level. Your diabetes control will be poor. It will increase the risk of other cardiovascular disease like hypertension and cardiovascular disease.
Right. A quick follow-up, Dr. Detroja. Constant working from home has led to the sleep patterns of many people being disturbed. There's no concept of, separate work and life in that sense. It's all within this continuum. Has that affected people with diabetes and cardiac disease more?
Because of this COVID pandemic, large number of people are working from home still even today, and they are starting their work very late and they will work till late night. So because of this late night working, their sleep will be disturbed. So we have very particular circadian rhythm or biological clock in the body. So because of that, there are few hormones like cortisol and other hormones which will be secreted more in the morning hours, then gradually over a period of time in the daytime, the levels of these hormones will come down. So this setting will be changed. Our clock will be disturbed. So that will lead to more stress, and that will lead to increased stress hormone release, and that will worsen your diabetes control. Also, because of this stressful condition and release of stress hormone, the obesity also will worsen. And because of late night sleep, we'll have a habit of eating at night. And when we'll have binge eating at night, that will cause weight gain. And this obesity and weight gain will further increase diabetes, and control of diabetes will be difficult.
Coming up after the break, a closer look at the warning signs that you need to look out for and what you need to do to manage stress better. That's in just a moment. Welcome back to Health and Wellness, Myths versus Facts. We're talking about stress and the management of metabolic conditions. Dr. Pandey, can sleep problems or a sleep disorder actually increase the risk of developing type 2 diabetes? And what are some of the common complications of long-term diabetes?
Sleep disorder and erratic sleep behavior can lead to diabetes. It has been found in various studies that shorter duration of sleep or sleeping at unusual time can lead to diabetes. Nowadays, we are using many of these smart watches. They calculate the sleep score. Sleep score is very important assessment tool by which you can have assessment of the quality of the sleep you are getting. So it's not just the duration, the quality is also important. So If you talk about the long-term complication of diabetes, most important thing to understand about diabetes is that it is a multi-system disease. So a multi-system disease in itself means that it can lead to multiple complications where multiple systems of the body is involved. It can lead to cardiovascular system involvement in the form of coronary artery disease. So there can be sudden cardiac death or there can be heart attack. It can lead to stroke. In case of renal involvement, it can lead to kidney failure. In case of nerve involvement, it can lead to neuropathy. So neuropathy can lead to abnormal sensation like tingling, numbness. Similarly, in a diabetic patient, it can lead to skin problems. Various ulcers can be there. It can lead to fungal or bacterial infection. Diabetic patients, as we were earlier discussing, can lead to depression. There can be memory loss also. So it's very long list of long-term complications if your sugar is uncontrolled. So if you are able to control your sugar in a proper manner, so do not worry about these long-term complications. These will be taken care of.
Dr. Detroja, Dr. Pandey mentions obesity. Now, can stress actually cause obesity, and does that in turn then make diabetes management even more complicated?
Yeah, that's true. Actually, whenever you are in chronic stressful condition, as I told earlier, the hormonal level like cortisol will high. So this hormone in turn will lead to more fat deposition in the body, and particularly it causes fat deposition in abdomen. So this abdominal obesity, we call it as a visceral obesity, that is the most dangerous of all. Because most of the metabolic problems like hypertension, diabetes, cardiovascular disease, cholesterol, all are exacerbated because of abdominal obesity. So this cortisol will also lead to increase in obesity. Now obesity in turn will lead to further difficulties in managing diabetes. Your diabetes control will be difficult. You will require more number of medications to control diabetes. And some of these medicines or this hormone level may cause further increase in weight gain. So it's a kind of vicious cycle that will go on unless you break the cycle and try to come out of the stress level and reduce the weight and control diabetes properly.
Right. Dr. Pandey, major stressful events or perhaps even sort of lower amounts of stress over a long period of time, what kind of effect can they have on heart problems? Can stress be an independent risk factor also? And, how do we measure this? What are the warning signs? What should we be looking out for?
Yes, stress can be an independent risk factor for cardiovascular disease in the form of sudden cardiac death or heart attack. It has been found in various studies that stress leads to endothelium damage, which directly can lead to multiple cardiovascular problems in form of hypertension, in form of sudden cardiac death or heart attack. And there is an indirect association also, like person who is in depression, not exercising, eating lot of junk food, so it is also leading to cardiovascular disease. So we have to aware about this problem, and it is very important to identify it. So how to measure the stress? That's very important point. So stress can be measured by different questionnaires, which can be taken care by psychologists and psychiatrists. They are qualified experts in this field to measure the stress. There are self-rating system, scoring system is also there, like the person who is going through stress can go through it and have a rough estimate about the stress. But I will advise patients to meet qualified psychiatrists and psychologists. They will better assess the stress by different questionnaires because each questionnaire has got some limitations. Now, what are the warning signs of the stress or excessive stress? So the warning sign range from the physical symptoms, it can be emotional, it can be mental. In the physical symptoms, it can be like a person suffering from excessive stress can have generalized body pain, headache, increased heart rate, sweating, palpitation. There can be gastrointestinal symptoms in the form of loose motion. There can be sexual difficulties. So various presentation of stress can be there. In emotional, it can be like person is feeling worried, or person is do not want to socialize. The forgetfulness can be there. Person is losing temper. So these are the common symptoms by which one can understand that the fellow is going through excessive stress.
Dr. Detroja, it's sometimes mentioned that vitamins and other supplements can actually help reduce stress. Is that actually true? And if so, how do they work in relieving stress?
Yeah, I can say it's true partly. As such, there is no direct relationship between any single vitamin level and stress level. But vitamins like vitamin B12 and vitamin D deficiencies are very common in general population. And whenever you have deficiencies of those vitamins, you will have symptoms like weakness, tiredness, fatigue, body pain. So these symptoms are also part of stress and uncontrolled diabetes. So whenever you give this kind of vitamins in this population, definitely it will be helpful in relieving these symptoms, particularly those people who are deficient in this vitamin level. So yes, I agree. In deficient patients, we should give these vitamins that will be helpful. But more than that, what I will suggest to my patients that you try to come out of stress, you do certain activities which will be helpful in managing your stress level, like regular exercise, particularly pranayama, yoga, meditation. This will be very helpful in particularly chronic stressful situation. And other recreational activities, whatever you like going out for a vacation, spending time with family and friends, using sports activity. So these things will be more important in managing your stress level.
Dr. Pandey, when we feel the effects of stress weighing us down, sometimes it's almost a physical feeling of heaviness. What stress buster strategies would you suggest to viewers? We've just heard Dr. Detroja lay out some. But specifically in order to prevent health complications caused by long-term stress, is there anything that you could prescribe?
Yes, I think stress is a very important part. It is an inevitable part of our life. Nobody is immune to stress. Every day we are facing the stress. So yes, we have the strategies that are very time tested also that one can follow. Like breathing exercises. The breathing exercises through inspiration and expiration can soothe your mind. It can reduce the stress. Do whatever feels good. Like if I am in habit of listening music which makes me distress, do it. A funny video which can make me laugh, that will be very de-stressing for me also. So if you want to join a class or hobby class, a gym, so do it. Try to be creative. I think creative like painting, photographing, any other art which you want to follow. And the most important part is whenever you have problem, try to discuss with your peers, with your friends, and that's a very important part. The other is like take a nap. Whenever you are in the stress, take a short nap. That will be very helpful.
Right. Dr. Pandey, Dr. Detroja, those were very helpful suggestions. A quick summary for our viewers. Watch out for those warning signs. Obesity is a physical stress warning. Other indicators are mood swings and frequent irritated behavior. These can be emotional warning signs of stress. Talk about it, don't bottle it up, listen to good music, try and relax with vacations, try and doing what you enjoy doing the most. A range of suggestions and advice from the doctors on our show. We hope it's been useful. Thanks for watching.